for everyone that's in this call. We really want this to be a very participatory session, and maybe a little bit less formal than some of the other sessions. So we just want to kick off by seeing who's in the call, because it might be a little bit different from the other sessions within the conference. So if you can go to menti.com, wmenti.com, and whenever you get onto that screen, if you can enter the code 4354927, and it should bring you to your first question. And that is, where are you tuning in from? Where are you watching this session from tonight? So we have Dublin, London, a couple from London, Belfast, Latvia, Germany, Turkey, India, Mexico, Fermanagh, rural Northern Ireland, Reading, Aberdeen, Haarlem, fantastic, Maastricht. So we have a good range across Europe and North and Central America. I guess obviously with the time difference, we might have lost a few of our colleagues from Asia, Africa, but this is a great, diverse group. The second question then is, which of these categories best describes you? Are you a student, researcher, young professional, or something else? So we have a lot of students joining us, but again, quite a good diversity and quite a few people as well in the other group, 6%. So hopefully in the conversations later, we can also hear a little bit about the different projects and work that different people on this call are involved in. Okay, thank you very much. So secondly, before we jump into the main part of our session, and before we invite our speakers to take to the virtual stage, we'd like to take this opportunity just to announce the winners of the Global Health Challenge competition. This competition was advertised before the conference, and we invited people to submit either individually or as a group a 5-minute video pitch of an innovative solution to a global health problem relating to the Sustainable Development Goals. I'm very pleased to announce that the winner of this year's competition is Melissa JiaBin Huang. She's a nurse and a founder and CEO at Infuse, which is an online blood bank and digital supply platform that connects hospitals and gives patients access to blood in Cameroon. I know that Melissa had intended to be on the call, so we will hopefully get a chat with her, but we're going to show that winning video now. And congratulations again to Melissa for this fantastic piece of work.
My name is Melissa JiaBin Huang, and I'm the founder and CEO of Infuse. I started Infuse, which stemmed from a series of events which I had encountered while in nursing school. I realized that blood was one of the really big problems that patients in hospitals face. And so we created a platform where with one click you could have access to the entire blood bank information of the various hospitals that had blood banks, and we were able to outsource exactly where they could find this blood. One particular experience that I had, I met this 5-year-old girl called Rita. She came into the hospital with severe anemia after a bout of malaria. The hospital that Rita was admitted did not have a blood bank, and consequently Rita's mom had to run all around looking for blood, and unfortunately 2 days later Rita died. Her life could have very easily been saved. We piloted this project in 2016, and we have been able to have access to all the 12 hospitals that have blood banks here in Yaoundé. We have 908 hospitals to expand into, and we have been able to transport more than 3,500 pints of blood. We launched this service about 20 months ago. We currently work in 2 countries, in Cameroon and Côte d'Ivoire, and have delivered over 4,000 blood bags to about 3,000 patients. in partnership with international and local organizations such as USAID and the ministries of public health in these countries, we want to continue ensuring that everybody who requires blood or blood components has access to this product.
So congratulations again to Melissa. It's an incredible project and a really effective video to communicate. I just want to check, is Melissa on the call? I know that she was hoping to join us tonight. I'm being told she's on the call. Melissa, are you there?
Hello. Yes.
Hi, Melissa. How are you doing?
I'm well, thank you. How are you?
Great, great. Like, congratulations again for winning this competition. It's really a fantastic project. It shows a real kind of success in bringing together different solutions for a very tangible problem, and a real example of a multidisciplinary project, a technological solution to a medical problem. I just wanted to ask, with this great project, what do you kind of think is the next steps for this work? And I know that you're also piloting some of the work in the Ivory Coast. I was wondering, is there potential to replicate this and expand it further?
Yeah, so obviously our primary goal has been to replicate and scale the project as much as we can. At the same time, we're also exploring other partnerships and other opportunities, such as, not only sourcing blood and blood components, but we now work with blood banks to recruit blood donors for them. And we're getting people that, are also just really interested in us just scaling the project. So I think right now our focus is just to see how we can maximize the impact that we're having with the project, while also, just adding values, increasing added value services such as, a blood donor recruitment, working with blood banks and hospitals and all of that. So, yeah.
Fantastic. And am I right in saying that you're a nurse and you developed this idea whenever you were a nursing student? Yeah. So yes. How did you develop such, I guess, a technological solution to this problem? How did you find that process? Has that always been something that's been of interest to you as well, or?
Yeah, I mean, I think that has always I have always been entrepreneurial. But I was born in Cameroon, and I didn't know that that was a possibility to be an entrepreneur. It was never something that I was exposed to. So even though I went to nursing school and I got my degree in nursing, I always had the feeling that there was something more I could do, because I was just very frustrated with the clinical aspect of nursing. There were just so many problems that were going wrong, and I just felt like, this could not be it. Like when I was in school, I knew that there was more that I could do. And it just so happened that when I was graduating, that was when I started just realizing that, there were other paths that I could take with this nursing degree, and not necessarily, go into clinical practice or stuff like that. So I think it has just always been in me. I just didn't know how to express it at that point, until when I found myself in a situation where I was forced to think, with the death of the young girl. That was when it was like a turning point for me, and I just knew that I had to do something differently, I guess. So, yeah, I think it just takes a little bit of exposure. A lot of people feel that just because, you're a nurse, so you're supposed to like work at the bedside and be like a clinical nurse and all of that. And I think that for me, it was just like, okay, I'm passionate about healthcare, but I feel that I can do something else. And I've always loved technology. I've always been like a little bit of a nerd. So it was the perfect way for me to combine the two things that I really love doing. So, yeah.
It's a fantastic example of bringing together skills and interests in a really in a really effective way. So congratulations again, and thank you very much for joining us for this session. If anyone's interested in more of Melissa's work, there's a couple of the links are in the chat box on the right hand side, and I think as well we're going to post up the link for the other videos that were submitted and that were shortlisted for the competition as well. So thank you very much for joining us as well, Melissa. We're now going to jump into the main part of
Sure, thank you for having me.
Thank you. We're going to sort of jump into the main part of the session now. And just before I introduce our keynote speakers and our panelists, I guess, you know, we were thinking about why this session, and why are we running this session on post-COVID and what it means for young professionals. And COVID is, as everyone is obviously aware, has dramatically affected and changed so many aspects of our society and our lives. And as global and public health professionals, we're in an interesting position because in some ways it's a fantastic time to be an early career professional in the fields of global and public health. This is a time when our work is clearly needed, that we can have an impact, and I guess mostly where health is at the forefront of political agendas. So in some ways it's a really interesting and invigorating time to work in this field, but it's also an unsettling and uncertain time for many people in our profession, not dissimilar to others. So in this session, we'll start to pull apart what COVID and what possibly a post-COVID world looks like for young professionals working in global health. So what does this new context mean for us? How will it change how we work and in what ways? Does it change our targets and how we hope to have an impact? What challenges will we experience? What will we experience? And is there opportunities within this and within this crisis to evolve our field into something different, to evolve it into something that's maybe more equitable, responsive, and flexible? And ultimately, what are our roles throughout all of this? How has COVID changed our field, but by proxy, how will it change our careers? So to help us navigate these questions, and we're joined by a fantastic group of panelists and speakers. I'll introduce all the panelists now, and then we'll move into kind of a more informal conversation. But delivering our keynote presentation will be Danielle Agnello. Danielle is the Executive Director of Global Health Mentorships. She has an MSc in Global Health and a BS in Microbiology. She has worked for 3 years at the World Health Organization and currently works on various projects with the WHO Regional Office for Europe and WHO headquarters. Following Danielle, we'll be joined by Dr. Shakira Chunara, who's an independent public health practitioner, 2017 Woman of the Year in Health in South Africa, and Destiny Magazine's Most Powerful Woman Under 40. Shakira is a member of the inaugural African Union Youth Advisory Council and has spearheaded a range of different health projects across the African continent. We'll be joined by Kim van Dalen, who is conducting a PhD in global public health as a Gates Cambridge scholar focusing on metal pollution and risk for cardiovascular disease. She's worked with IFSMA executive at local and national level in both the Netherlands and in the UK, and has co-founded initiatives such as the People's Climate March in 2017 in Amsterdam and the Healthy Planet Cambridge. Next to her PhD, she's currently working as a consultant on the Lancet Countdown and as a research associate at Women in Global Health. And finally, we have Dr. Eamon Fowler, who is currently working as a specialist registrar in infectious diseases in Cork University Hospital. He graduated from medicine in Trinity College in Dublin and completed a diploma in tropical medicine and hygiene in Liverpool. He's currently enrolled in an MSc in Health Economics Policy and Management in London School of Economics, and has worked with Medicine Sans Frontières in 2017 in Kenya on an HIV-focused project and participated in the MSF response to election-related violence during his mission. So we have a fantastic panelist, and I'm going to hand the floor over to Danielle shortly. Following the panel discussion, we are going to have a short virtual networking event as well, which will be your chance to meet the panelists. So if you do have any questions, do also keep them for you'll have an opportunity to ask them on a one-to-one basis as well as in the larger Q&A session. So to kick us off, Danielle, I'd like to hand over to you. Danielle's going to be delivering a talk titled A Window of Opportunity, How We Turn This Crisis into a Much Needed Paradigm Shift.
Thank you so much, Chris, and good evening to everyone. I hope you can hear me okay. I'm very grateful to be part of this session. I'm very excited to see that we have 80 participants, so I hope we find ways to hear from all of you, and I very much encourage you to take advantage of those after session conversations. So I'm just going to start out and share my screen with you all here in one moment. Okay, so hopefully you can all see the first slide of my presentation. Chris, everything clear on your end?
Yeah, everything's clear.
Great, fantastic, good. So when I was asked to give this presentation, I very much, like most of us, started to dive deep into the COVID research, and it's very easy to quickly become despaired and overwhelmed with all the challenges and concerns that we're facing. So I decided that I wanted to take this presentation and turn it into something positive and a way for us to look forward in the future, very much in line with what this conference is asking us to do with the idea of healthy people on a healthy planet, setting out this vision for us. And I really want to take these 20 minutes to also start a conversation for all of us, and specifically for the panelists that will come after me. So I'm going to ask you to use the chat box, and if possible, just show me what you can see. I don't know if I could see the chat box when I'm sharing my screen, so maybe Chris is willing to yell out a few of the responses that pop up there.
So we have rabbit, duck, duck, an old lady, duck, duck, old woman, duck, duck, duck,
Okay.
woman, lady, young woman, duck, an old lady, duck, and young lady.
Perfect, thank you, Chris. Yeah, so it seems like you guys are very perceptive. This is a good example. So I brought this in to introduce the idea of paradigms. So paradigms are models of understanding that remain consistent without any significant contradictions over time. And when the idea of paradigm shifts came about by the philosopher Kuhn, he used this duck-rabbit optical illusion in order to demonstrate that a paradigm shift is really looking at things from a new perspective. And in the words of the very great and intelligent Einstein, the midst of every crisis lies a very great opportunity. And I think this crisis that we're in right now lies the opportunity for a paradigm shift, forcing us into change and forcing us to build a more socially just and sound future. And coincidentally, the word crisis in Chinese is signified by two characters. One represents danger and one represents opportunity. So to illustrate this, I want to do kind of a very brief history lesson that I'm sure all of you are very familiar with these diseases. So we have smallpox, very, very devastating, deadly illness. They think it's originated all the way back to the Egyptian Empire. And then with the advent of the vaccine by Edward Jenner, this new idea came about that humans can actually prevent these pandemic diseases. And this very excitingly had the first Royal Philanthropic Vaccine Expedition, which I would consider the very first public health campaign, where the Spanish king sent this convoy to go spread the vaccine to the Spanish colonies. So this paradigm shift was that now we can actually prevent these illnesses. Another hard hitter, which we are still dealing with today, is cholera. And cholera was a disease that was spread through water, but at the time, people didn't have that understanding. The miasmic theory of disease was the strongest and predominant paradigm at the time, thinking that disease was caused by foul odors, so from the pigsties, the droppings, the livestock, and tanneries. And through this understanding at the time, they only focused on sanitation of foul-smelling things. But luckily, we're all very aware of the Broad Street Pump work by John Snow. He was able to show that disease actually was spreading through the water. So this was shifting the paradigm to now understand that miasmic theory of disease is no longer correct, and that there's actually disease spreading through other modes. And the other paradigm was that it sparked the construction of improved sanitation. And finally, I think this one's the most exciting considering where we are today. It was the H1 pandemic in 1918. And while I was doing my research, I came across these flyers that were posted up around the United States that look very, very familiar, I think, to all of us today. And this shows that the H1 pandemic shifted us to understanding how we should prepare and deal with these respiratory illnesses. And specifically, I wanted to highlight 2 lessons learned. As you see, we have our anti-mask meeting flyer calling people to come and protest to the totalitarian forcing us to wear masks, and also flyers going around about how to make your own mask. So it kind of teaches us that our challenges are not so unique, and maybe we do need to reconsider how we address these issues. And another lesson learned is that this virus can stay in circulation and come back to haunt us. So that's with the title post-COVID, I feel, and we're probably all understanding now, that we're not going to be post-COVID for a while, and very much is likely that this strain can hibernate and come back to haunt us later, like we see with the H1N1 strain with the 2009 epidemic. So why am I going through history and philosophy? Essentially, I'm trying to bring these pieces together to show that this means something for COVID-19 and for us as the public health and global health workforce. COVID-19 is very much calling for us to have a paradigm shift, not only in health, but in sectors beyond health. And therefore, I want to take the next slides to really focus on what we can do now and the opportunities that I see for us to change and evolve ourselves, how we work in our fields that we work in. So these are what I call the opportunities, and I brought them into these points here. We have think beyond health, expand your knowledge, participatory community engagement, build bridges, digitalization is here, fight for failure, and be a climate activist. And again, I can't go, these are very, complex topics. I know all of you in this call probably specialize in different areas, digital health or, looking at participatory engagement. So I'm not going to go into detail, but I'm going to briefly go through each of them as a way to start the conversation. So first of all, we need to think beyond health. And I know from my own studies, and I'm sure from the studies you're going through now, we're told that we need to be multi-stakeholder. We're told that we need to work with other sectors, but I don't think we're really practicing the how. And I don't think those other sectors have been so aware that they need to work with us until now. We're seeing with the COVID pandemic that we're getting other fields, other areas actually taking on the public health activities. You see this with media and culture, tourism, forestry, food retail. We're understanding who our essential workers are. So it really sets an opportunity for us to start engaging with those sectors more and make sure that we do this in a very collaborative, solution-oriented way, trying to make meaningful engagements. So no more talk shops, no more consultative sit around a table meetings. I think we really need to move forward with action. And I think this really is a very important lesson from COVID pandemic, and it shows us the importance of working together. You need to expand your knowledge. And I really like this quote by the paradigm shift author, Thomas Kuhn. He says, individuals who break through by inventing a new paradigm are almost always either young or very new to the field whose paradigm they change. They're those who, being little committed to the prior practice, are particularly likely to see that the rules no longer apply. And I like this because it emphasizes the importance that not only do you work with these other stakeholders, but you try to immerse yourself into these other sectors. Always learn, always try and get new knowledge about different areas. It not only will help you look for a new paradigm, but it will also help you have those conversations with those stakeholders in a meaningful and valuable way. And in order to do this, in my work, I've really seen
I just lost Danielle there. We'll maybe just give it a second and see whether her connection joins again. If not, we'll move on to the next speaker while she hopefully is able to rejoin us.
I apologize. I think my internet must have cut out there.
Don't worry at all. We've got you back now.
Okay. Yeah, hopefully that won't happen again, but I'll just keep going forward. So I believe this is where it cut out when I was talking about community engagement. I just wanted to highlight different areas where I think we can strengthen our skills and making sure that we're able to build trust with our community. We're able to quickly and effectively mobilize and empower these communities. We need to protect them from misinformation, which we have seen come up so strongly in this COVID pandemic. And we need to learn to be able to communicate complex problems, because now people are interested in the health. It's very much at the forefront of their everyday thinking, and we need to be able to have those conversations with community members so they understand how they can move forward, how they can change their behaviors, and how they can protect their loved ones. Building bridges is very important, and this specifically, I want to highlight building the bridge between academia and policy. We're also very aware of this, but I think we haven't built that bridge yet. We're definitely seeing that it's very important for a government to be able to react quickly to something like a pandemic with the latest research, with the most understanding of what needs to be done. And this is where we need to focus more on implementation science and more on building, taking research and putting it into something that's actionable. And very much so, I think the pandemic has showed us that national governments are able to enact drastic measures to immobilize their populations, suspending entire economies, which is not something we've seen beyond wartime. So we know that governments have this ability. We want to be able to find ways to give them the right information and the right tools to enact what we think is important in terms of protecting public health. I won't go through each of these, and I think we can't even go through anything about COVID without mentioning digitalization. Digital behavior is changing, surveillance is becoming a very easy, accessible thing, and it's able to track so many different aspects of human behavior and also disease behavior. Everything's accelerating. COVID's given this increased pace for telemedicine, video conferencing. We're able to monitor health in different ways. We're able to clinically manage people in more digital ways, and testing is also changing. And this means that we really need to get comfortable with these tools. We really need to increase our understanding of them and how we can use them. And this one, which I think takes a little bit more convincing sometimes, but I like to call it as fight for failure. And I very much experienced this in my own professional journey, that in the public health sector, we're very, very concerned about failure because failing costs lives, right? It's not an emergency room. It doesn't cost lives in the public health, global health sphere. We need to be able to innovate. We need to be able to adapt. And this means we need to fight for that space in our organizations to allow us to fail, to allow us to try out new things. And these are just some examples that I think are inspiring. We have Google has this whole process for analyzing their mistakes or failures. A very well-known mistake that's led to, an amazing drug is Alexander Fleming accidentally discovering penicillin because he was a very messy person. And then there's this very fun example in the UK where they call the Church of Fail. And that's where they have monthly rituals where employees are invited to stand up and confess to mistakes they have done. And they're applauded for that. And people kind of, turn it into something fun so that we're not so scared to innovate. And finally, I want us to be climate activists. I know most of you probably already are, but as everybody is aware, the climate and agendas splits people, divides people. And I think we as health professionals need to become climate activists. There's so many aspects of how climate change is affecting health with food security, access to water. We have NCDs that are affected by air quality. You can just see this in the whole West Coast on fire right now, and specifically human-animal interactions, which has brought about COVID. And I think it's very much time for us to shape that narrative beyond the energy sector and really bringing it into the health sphere. So to walk away from this, I want you guys to have kind of some 3 key messages, and that's behavior change and perspective. And I really like this quote. It says, a revolution doesn't happen when society adopts new tools. It happens when society adapts new behaviors. So maybe we don't necessarily need to change what we do, but we need to change how we do. And we need to look through our skills and methods that we've been kind of playing with and decide which ones are going to be the best utilized to drive us forward in the future for that healthy future that we want to see. And change, we very much, when we're hit with the crisis, we have that choice if we want to make that paradigm shift. We have that choice if we want to move into something more humane, more resilient, and we have to take the action to do that. And perspective, you're obviously all a very group of perspective people with perspective, because you could see the old woman and the young woman and the rabbit and the duck. And I think this crisis really highlights the fact that an old paradigm maybe no longer fits the model of how we want to live. And maybe it is time for us to shift into a new way of living, new ways of shaping our economies, new ways of dealing and interacting with the government sectors. And for those of you that aren't aware, we offer, they had asked me actually in my presentation, talk a bit about GHME. I kind of went down this other road and felt more excited, but I just wanted to mention that Global Health Mentorships really tries to utilize the power of networking and facilitated engagement to help mentor students and young professionals in their careers, because global health and public health is very emergent, adapting, changing constantly. And in that sense, it makes it difficult for people to kind of map their way forward and where they want to go. So please reach out to us. We've already started our program this year, but we have a program every year, and you can check out more details on our website. And I just wanted to thank you all. Thank you again for inviting me. I hope that I touched on some ideas that we can talk about further. And I apologize if it was a lot in a very quick time. And I just wanted to end with this very fun 1920s poster from the H1N1 pandemic, because at that time, they found men were the ones that weren't adhering to public health kind of interventions and weren't wanting to wear a mask or not spit. So they started to make targeted male flyers. So that's what you're seeing here. And that is all for me. I will give the floor back to you, Chris.
Thank you very much, Danielle. That was a really, really interesting talk. It's amazing just how history does repeat. A couple of the graphics that you show there obviously resonate very strongly today. We're going to hold questions until all the panelists have had a chance just to respond and give a few of their thoughts on this topic, and then we'll open it up to the floor. So if we just move on next, Dr. Shakira Chinara, if you want to take the floor, and it'd be really interesting to hear what you think of Danielle's presentation and more broadly this area.
Hi, Chris. Danielle, thanks so much for a super awesome presentation. I wasn't expecting anything less, having connected virtually before. I guess it's good evening in many parts of the world, and South Africa included, where I'm coming in from. Danielle's presentation, but also the topic itself, is something which sparked a few wheels off in my head. And I suppose the one or two elements I'd respond to in terms of Danielle's presentation was that our universities, and I noticed that many who are joining in as students, our universities simply do not keep up fast enough with real life problems and implementation problems. And while there are some universities that do it, I think a curriculum is something very difficult to shift and change. But I do appreciate some settings which try and incorporate this learning, and I think that's very important. The other aspect I'll speak to towards the end of I suppose, my intervention will be around some of the topics and the way I see global health shifting. Of course, I'm not psychic, so these are really going by my opinions and the way I think that things may go, of course. So I'll pop a link just now. I've just switched computers, so I need to find that link, but there's actually a report by the International Labour Organization, which is very interesting. It collected about 12,000 responses from young people across the world, 18 to 24, and it looked at the impact of COVID-19 on their jobs, on their schooling or university education. And obviously what it found was that up to about 75% of students suffered disruption in one form or the other. And there's different statistics around this, but essentially what it meant is that many who attend university, especially public universities, such as in South Africa, we've got a two-tiered system. Those universities that were not, for example, well equipped or well resourced, meant that online learning never happened in a 3 or 4 month lockdown period. So there has been significant disruptions. Then we know traditionally, even before the pandemic, many young people were already either in short-term employment or poorly paid employment. And what this means is that there's either been a reduction in the salaries that we have, or we've been let go of. And, I just want to pause slightly at that point to say that if anyone's listening in and some of these experiences resonate with you or your colleagues, please, we'd love if you shared with us, because I think this pandemic has been really real. And as Danielle said, we're still very far from that post-COVID context, as we're seeing with many second waves. I'll speak from a realist or a real perspective of some of the experiences I see coming out. The university sector, for example, has experienced a lack of funding or a drop in funding. And then some of the other areas we see is it's taken us so long to have youth participation and youth involved in different policy spaces or different projects. And with the pandemic, things have gone virtual, of course, but I think that this is pushing the carpet from under us. And what we need to do is make sure that even in these virtual spaces, we continue to push youth participation and engagement. I think that's going to be a very key issue within the pandemic and post the pandemic. I'll also speak a little bit about myself, and maybe that will also elicit some of your experiences and your thoughts in terms of where you're going. I mean, I was a student about 3 or 4 years ago, completed my education, but we never stop learning. Nonetheless, as a young professional, I quit my 8 to 5 about 3 or 4 years ago in search for greater purpose, greater meaning, more impact. And wham bam, there comes the pandemic. I used to be a facilitator for high-level conferences and meetings between October and December, working with presidents and first ladies, being in the policy space for health and young people. And what this has meant is an immediate loss of income. And so those are some of the realities that, even though we're looking for opportunity, those are some of the realities that we're facing. Many of us are losing a third of our income. But it's not all doom and gloom, because in line with the topic, I'm actually excited about the fact that we don't need to fly 1 million hours to get somewhere. We don't need to have a big, massive meeting in a fancy hotel. What's the carbon footprint of that? So is this the world becoming more efficient? Are we forced to become more efficient? We saw the International AIDS Conference move from San Francisco this year to online. And how do we as young professionals keep that efficiency within the system? And hopefully that money needs to flow to patients and needs to flow to communities. And I'm jumping all over the show. I literally jotted down notes because it's Heritage Day in South Africa today. And during an event, I was, jotting down some things. But I think some food for thought in terms of what we'll be facing, what we need to help each other with, and what we need to ensure for young professionals are 3 things. Based on what I said, we need to make sure that everyone has a chance to complete their education. Those who find difficulty now entering the education space, we need to help propel them up. It's our responsibility. I think it's always been difficult to enter the job market as a public health professional or a young health professional, and it's going to be even more difficult to do so. And my point a little bit earlier was also, once we enter, staying within the market is going to be extremely difficult. Before COVID-19, many of us, probably millennials or Generation Z, we've never worked in a proper office. Most of us have worked virtually, so this is not very new to us. But one element that does come to mind as we work virtually full-time, absolutely full-time, is self-care. And what this means for us as health professionals. What does this mean for us taking care of our eye health, our back health, our health in general? And I'm speaking from experience, because during lockdown, I suffered a little bit with health problems, working 48 hours a day. I wouldn't say 24 hours a day. So the increasing demands that are placed on us as young professionals. Youth have also faced a lot of vulnerability during this time. Quite a few colleagues study outside of their home countries. Because of the cuts in funding as well, many are unable to return home, or even they're grounded because airlines are not flying. So what does this also mean for us as health professionals? And yeah, I'm really trying to get you all to think about the future. What does it mean for us to go and study in other places, work in other places, travel, and also the fact that countries will now be wary about letting others in, that increasing sense of nationalism. A very big issue I think we can also think about, and totally jumping around here again, is the loss of global health governance, or the threat to global health governance. We've seen WHO being in serious question during this pandemic. We've seen some countries stepping up to match the funding of the United States. But what does that mean for global health? What does it mean for those of us who work in low and middle income countries as well? Where our health systems are largely supported by donors. For example, I worked in a country recently, which I shall not name, but 97% of its health system is financed by donors. So our health systems are really on the brink of collapse with this threat to big global institutions we would traditionally work at. What does this mean for us, I think? What I found during this time, and what we need to think about, especially in low and middle income settings, is it's been really difficult to reach communities. While I'm happy that the expense of big conferences are hopefully gone out of the window, there is a need to always work and engage with communities and patients. Working with people living with HIV, working with rural women, it's been really hard. You cannot expect to get onto a Zoom call and do your data collection and work on issues of gender-based violence. It simply just doesn't work. But again, like Danielle said, there's room for innovation. So for example, just thinking of the HIV self-testing kit, that shows us new ways and new methods of care, new ways or pathways where we don't need someone to come into the health facility anymore. And what are some of the lessons we can learn from COVID? So I've said quite a lot, but I want to end off with a few topics, because I think that's where students and young professionals need to start to think about, because what we see is every time something happens in global health history, the shift in focus is there, and the shift in focus to COVID is there. And I think there's a few areas which will really take off. And I hope I can read my own handwriting when I say this. Of course, like Danielle said, digital health will be big. We will be following the investments, the work on emergency and preparedness. Vaccine development is something interesting, booming at the moment. It's coming up. What will the future hold for us in those fields? What was very interesting to see during this entire pandemic was the exposure on racism. And we saw a lot of writers talking about global health racism after George Floyd. We saw a lot of young people and previous staff at the global organization Women Deliver come forward. So I think there could be something around stigma, discrimination. Then there's going to be something around health system recovery for sure. Our health services have been disrupted. Finally, stigma, discrimination has been big during this time. We all are avoiding each other, and how do we deal with the disintegration and private sector innovation? For me, of all the actors in the field and where many of our futures lie, we've got a lot to learn from the private sector. They've adapted very quickly. And they've been very resilient, and lots of innovations already coming through. So I've really said a lot. Let me pause there for now and give the others a chance. Thanks.
Thank you so much. Yeah, so much to think about, and I'm sure in the Q&A we'll definitely get into a number of those topics in more detail. Really interesting what you're saying around kind of lack of security and difficulties for young people in working in a virtual world, even though there's opportunities in that, you know, taking care of our own health. Lots of different areas that I'm sure we can explore more in the throughout this session. So I'd like to hand over to Kim now, if you'd like to give a few thoughts on this topic.
Yes, thank you so much. It was very great to already hear from Danielle and Shakira. I have prepared a presentation, so I will quickly try to share my screen. Do you see my screen now?
Yep, that's it.
Okay, brilliant. So as you may have already heard quickly during the introduction, I'm currently a PhD student, which means that I spend most of my time working on environmental epidemiology. So I kind of wanted to have more of a perspective on research and how the research agenda is changing, and how I think this is influencing especially a lot of young researchers and young researchers that are becoming researchers. But before that, I really want to thank Rosie and Chris for inviting me, and also Hala for supporting with the technology. I'm very honored to be part of this panel with brilliant speakers as Danielle, Shakira, and Eman. And also thank you so much for all the people that are here. I saw that there are also some people from my home country, the Netherlands, which is always nice to see. Furthermore, I also want to say that I'm not necessarily an expert on this, so I'm happy if people want to correct me on things. And I think it's important to recognize as well that although all impacts of all parts of society are being impacted by this pandemic, that the most vulnerable people, like those of lower socioeconomic backgrounds, are worst impacted both short-term and long-term. So although that I'm now focusing mostly on academia, that is something that I really want people to take in mind as well. So to come back to COVID-19 and the impact of academia, much of my own thinking has really been influenced by Professor Pai, who has been written a lot about the COVIDization of research. And I would really recommend you to read these two publications that he wrote, and also to just generally follow him on Twitter, because he has great insight in COVID-19 as well as in global health in general. With that being said, I think, like we've heard already, this is really a time like no other. And everyone has been adapting to this, as well as academics have been adjusting to this new time. And what we have seen is that never before that so many researchers across the world focus so urgently on one single topic. Nearly all other research, whether it is working on specific protein-protein interactions or working on the next quantum computing, was brought to a halt. And this exclusive focus on COVID-19 has also reflected on how funding is allocated and redirected from other sources of funding, how academic journals prioritize publications, and how the media is mostly focused on COVID-19 research. And this refocus on COVID-19 in research spaces brings a lot of opportunities. We've already heard something about interdisciplinary collaborations, and also a chance for a lot of people to help with dealing with this pandemic and to get back to some form of normality. It also helps with potentially faster ways to developing new drugs and vaccines. And for some junior scientists like myself, you can get a chance to have a high impact publication that helps you with your further academic career. However, this focus on COVID-19 specifically also led to a rise in so-called armchair epidemiology and lowering of academic standards, as seen by the retraction of a lot of research, academic noise, And this leads to a considerable waste of time and researchers, as well as multiple scientists that are presented as experts just because they have a PhD, communicating about topics they know very little about and provoking confusion among the general public. Furthermore, I think that's really important as well, that when we are refocusing on COVID-19, a lot of areas of research like climate change, where we have a lot of experts, that there is suddenly a shift from expertise to COVID-19, and we're missing out on research on key areas such as climate change or such as antimicrobial resistance or tuberculosis, where Professor Pai very clearly alluded to. So, of course, it makes sense that we have a lot of people that are now focusing on COVID-19, but I think an important point to make and an important point to think about is that we shouldn't undermine other areas of research that are also important to prevent other future crises, be it the next pandemic or climate change specifically, or non-communicable diseases that are already being chronically underfunded. And this shift to COVID-19 is, of course, not specific to academia alone. Everyone is now more focused on COVID-19, be it researchers, be it policymakers, or the public alike. I recently had a meeting with people from the World Bank who were mostly working on climate change, but stating that they were really afraid that their work wasn't actually relevant anymore as long as they were not able to link with COVID-19. Similarly, we have seen that there's a delay of the COP26, a pivotal meeting for climate change, for the climate change agenda, which has been postponed to the next year. And even when scientists report, for example, that the observed ice sheet losses in Greenland and Antarctica put us on track for the worst case scenario of the IPCC fifth assessment report on sea level rise projections, there's very little covering of that in the media because most of it is focused on COVID-19. And I think it's really important that although we are focusing on that right now, that we realize that there are a lot of other global crises that may now seem as distant and abstract can have a really real impact if we keep postponing them and if we keep not focusing on that with our research as well as with our policy. For climate change specifically, delays in climate change action and research have the risk to slow down the progress in the struggle against climate change specifically. And the thing is that COVID-19 itself is actually already showing how interconnected health actually is and how interconnected health and other factors as social factors, economic factors, and environmental factors actually are. We've already seen that due to COVID-19 and restrictions that a lot of people are deprived from access to education because they don't have access to online resources. We have seen that there are gendered impacts of COVID-19. We have seen that people have a lack of essential medicines, etc. So I think it's really important that although we are now focusing on COVID-19, that we realize that first of all, it is impacting a lot of other aspects of human life, but second of all, that there are a lot of other crises not directly linked to COVID-19, such as the climate crisis, that are also upcoming, and that we shouldn't lose sight of those crises as well. And I think that this COVIDization of research and of the broader society has a specific impact on researchers as well. You may have seen that there were several publications already around that show that there's a specific unequal impact on young researchers, on women scientists that remain primarily responsible for their dependence as children, for those that are doing lab work in physical laboratories with time-sensitive experiments, and especially for scientists with very young children, they have seen a decline in time that they can devote to research. And there have been a lot of suggestions to deal with this, such as tenure clocks for extension for junior faculty. But at the same time, it's not really recognized that uniform policies may also have unintended consequences and exacerbate pre-existing inequalities. And the former things already have been well documented, but this effect of COVIDization and this effect on mental health has been less documented on young researchers and on research itself. This while a lot of the people around me are really asking themselves, okay, but how are we still getting our work published if we are not working on COVID-19? How do I get my university's attention? Am I still able to finish my PhD? And more existential crises as if I'm not working on COVID-19, is my work even important, or does it even matter what I am doing? And there are a lot of people that have therefore been trying to reconsider their academic careers, postdocs that have been really pessimistic in a way about whether they are still able to continue in academics. As of myself, whenever I introduce myself as being an environmental epidemiologist, the first question I will get is, do you work on COVID-19? Because there is really this imperative that if you are a biologist, or if you are an epidemiologist, or if you are a medical student, that you should be working on this, which gives a lot of guilt. And I think is something that is not really well documented and is quite unfair to a lot of people, because a lot of the other research is extremely important as well and should be addressed as well. And it is something that I think Professor Price's work did really well for me, is that he really showed and really explained, well, okay, we may be focusing on COVID-19 right now, but the other work is still really valid and really important as well. And we should be really focusing on other areas of research and other areas of policies to prevent future other crises. So I realized after saying all this that my presentation may have been a bit more pessimistic than the other presentation. So I would very much refer back to Danielle for all the opportunities that the COVID-19 pandemic also brings. But I do really think that it is important to think about where we focus our research on and where we focus our policies on, and that we really must not forget about other critical global health problems, such as climate change, before it is too late. Specifically because COVID-19 emphasizes this intimate connection between health and a lot of other environmental, social, and other factors. But similarly, like already alluded by Shakira and Danielle, COVID-19 does provide a lot of lessons that we can use for future crises, and that we can use to direct our research, and that we can use for a lot of opportunities to shape the world towards hopefully a more healthier planet as well. And before ending, I do want to say, for every student that is here and that is wondering what they should be doing with their research or with their PhD, that your research is worth it, and that you should continue and feel confident in what you're doing, because other research and other things than COVID-19 are really, really important as well. And I think that was it.
Thank you very much, Kim. Really, really important perspective to bring to this session around COVIDization of all of our work. I think it links very nicely with what Danielle was saying before around perspective. I know that I can empathize a lot with what you're saying, as you know, when this all started 6-7 months ago, when it started coming to Europe 6 or 7 months ago. I very much questions, you know, my work in cancer and feeling like, oh, I should be working on COVID. Everybody's working on COVID. I should pivot my career and go and work on that. And I think the perspective that you're calling for is incredibly important. So hopefully we'll be able to talk about that later in the session as well. And there's been a couple of really good links that have been put into the chat box by Rosie and by our admin team here, with other articles that are talking about the same sort of thing that Kim has raised. So if you get time, please do have a look at those as well. So our final panelist to give us some thoughts on these diverse and wide-ranging themes is Eamon Fowler. Eamon, if you want to take the floor.
Thanks a million, Chris. I'd like to first off thank the other speakers for their talks. There's some fascinating insights being shared. Just to introduce myself, Eamon Fowler is my name. I'm working in infectious diseases in Cork in the south of Ireland. In the past, I've worked with Médecins Sans Frontières, and I'm also doing an MSc in Health Economics, Policy and Management at the London School of Economics. Ironically enough, I'm actually at home isolating at the minute. So I suppose given the extra time I've had to prepare this presentation, there's no excuse if it isn't up to scratch. I'm going to talk a little bit about my personal experience of the pandemic and the parallels with work I've done in global health with MSF, and perhaps share insights from that experience that may be applicable now. First off, just with regard to the other material we've seen, I want to say congratulations to Melissa just on the wonderful video initiative, really amazing stuff. That sounds like it's hugely impactful. Then I suppose with what Danielle was saying, I completely agree regarding the paradigm shift. If we look at the last time, I suppose, that people talk of a great crisis in 1945, what came out of it was far from perfect, but I suppose the UN and the WHO did stave off nuclear war, which would have been the great threat of that time and of that age. And I suppose with moving on to Kim, what she was mentioning with regard to climate change and other areas of research, I still do believe that even with COVID-19, climate change is the most important challenge of our time. And I think that's the threat that we'll have to stave off in the aftermath of COVID-19. And I'd also say, watch the space with regard to pessimism. I did my best with the talk, and hopefully I can end it on a positive note. But we'll get into the presentation now. So I suppose I'm just going to start off back to those early days of the pandemic, what seems like a million years ago now. And I remember in this part of the world looking with curiosity at what was happening in China, perhaps not taking the situation entirely seriously, if I think we're all honest, and seeing the crazy stories of the lockdowns and the massive hospital facilities being built in 10 days. I think there was a definite perception in the West that this couldn't happen to us. And illustrated at the bottom here is the by now infamous Global Health Security Index pandemic preparedness chart, which ranked the US #1 and UK #2 in terms of pandemic preparedness. And I think that type of thinking was definitely what influenced us back then when we were thinking about what would happen when coronavirus did arrive. So I suppose everyone kind of has their intro story to COVID-19, where they realized that this thing that was happening would actually change everything in the world quite profoundly. And mine was the week of the 2nd of March. The first case of coronavirus only arrived in Ireland on the 29th of February. And it was an imported case. And 2 days later, as an infectious disease registrar in the hospital I work in, I had a consult in intensive care, and it was severe pneumonia in a 43-year-old male, not improving despite broad spectrum antibiotics. He was from a rural area, a farmer with no foreign travel or kind of significant exposure history to endemic areas at that time, which were Wuhan, South Korea, Italy, and Iran. In any case, the question on everyone's lips even then was, could this be COVID? Based on what we knew then, we doubted it. He was admitted to hospital before the first reported case in Ireland, but without another diagnosis. We did the tests, and it took us kind of 2 days of humming and hawing to finally come to that decision. And it was positive. That's a headline from the news in Ireland that evening, and this is one from the next day. This presented a huge number of problems all at the same time. We were terrified because in Italy 3 weeks prior, there was a very similar situation of a non-epidemiologically linked case, and they were suddenly engulfed by a rocketing outbreak. What we knew now was there was COVID in the community in Ireland, and there was an outbreak in our hospital. We essentially had to completely change the way we were providing services, and had to do so yesterday, really. And like more or less every hospital, like kind of in the world at this point, we extremely hurriedly embarked on setting up some critical infrastructure, a remote testing center, an ICU for COVID patients, a completely different emergency department stream for respiratory patients, and a move to ward-based rather than team-based management of patients, so to prevent people moving around the hospital. And in this part of the world, like health systems usually move extremely slowly, and things happen very slowly, and not unreasonable given the usual context, but anything new needs to be drafted, formalized, protocolized, and signed off from many stakeholders and safety officers before anything can happen at all. And now all this stuff had to happen immediately. And I suppose the situation in this kind of Western hospital ended up having a lot of parallels with an emergency context. I kind of felt in this work, it's obviously very different in some ways, but I felt nearly rather than going away on a mission with MSF, that the mission had come to me. The only experience I'd had of setting up new clinical spaces was setting up clinical outposts during the violence that followed the election in Kenya in 2017. And certainly in this completely unprecedented, extremely high pressured and stressful situation, like the experience of that was definitely what I drew on the most in terms of helping to put these structures in place. And the kind of experience I have, even if it was quite limited, was really valuable. And having spoken to others with this kind of experiences, I think working in the West, they have felt similar. But I'm actually going to change tack a little bit here. So that was the initial kind of frantic period, and with it there was an enormous amount of adrenaline, goodwill, and solidarity. But what we actually have to prepare for is a resilient long haul, because as well as for our workforces and populations' physical health, I think we're in an almighty battle for our mental health as well, with kind of no end really in sight at the moment. I think it was touched upon before, the idea of post-COVID is now like in the past, and what we're thinking about is kind of living with COVID for the foreseeable future. I think we'll hopefully break this record, but the fastest vaccine ever developed was actually the rubella vaccine, and that took 4 years from inception to licensing. I think we'll do a little bit better than that, but it gives some context about kind of the difficulties that there are in developing vaccinations. As well as that, we look at the effectiveness of another respiratory virus vaccine. That's a chart of flu effectiveness by year, and although it is an extremely important weapon every year in combating it, it does have very much varying effectiveness, and it's something that we might have to be prepared for with COVID-19. The hope would be coronaviruses are actually more stable viruses than flu viruses, so I'd hope it would be more effective with kind of less mutation. But I do think we do have to be kind of guarded in our assessment of the future and what's coming down the line. As I said, at the moment, there's like it is, as Kim was saying, a completely unprecedented human kind of venture. There's like an incredible amount of research going on, and it has produced 169 COVID-19 vaccine candidates as of now, 26 already of which are in the human trial phase. But I suppose even with that massive human endeavor, there is the question of equity and this horrible term, vaccine nationalism, that's being thrown about. So I suppose, having drawn initially on my own experience working on a different context in the acute part of this pandemic, I wonder, looking at the long haul and looking at a more resilient long haul, was there anything further that I could learn to help me through the more extended bit? And I suppose there is, like, NGOs are far from perfect, but one thing they have experience in is placing people in unfamiliar, difficult, and stressful contexts. And I think one thing that COVID has placed us all in is an unfamiliar, difficult, and stressful context. And I suppose with MSF, it's important to be cognizant of having all of us being thrust into this. Before going away with MSF, you usually have a psychologist input as part of your pre-departure briefing, and a facility for talking with someone available throughout the mission. You have relaxation or rest and relaxation periods for different frequencies depending on the intensity of missions. And essentially fluctuations in mental health are perceived to be kind of a normal part of this type of context and this type of situation. And it's more an expectation that you might need help at some point rather than the other way around, rather than the status quo. And then the other thing, I suppose, that's available in a mission type scenario where you go away with an NGO is an end date, and that unfortunately isn't available here. I've highlighted the expectation of fluctuations in mental health as normal part of this kind of situation, because out of those four things, it's the one thing we really have agency over. And I do think that, like, accepting that this is a long haul and accepting that these fluctuations are part of the process is really important in kind of preserving our mental health on a more long-term basis. I suppose, just to summarize, so between COVID-19 and the future and this kind of prolonged pandemic, it has brought emergency context and pandemic management to unfamiliar domains and to kind of all of our domains. The ending is uncertain. The timing, effectiveness, and rollout of vaccine are all kind of far from certain, although hopefully won't be kind of too long in the offing. And as well as a massive human endeavor to preserve our physical health, there should be one to preserve our mental health as well. And I'd just like to finish with to repeat that the fluctuations in our mental health are completely normal in this type of situation, and that like no one should really be afraid of that, and people should should grasp that and confront it. And ultimately, I honestly do think, in spite of all that pessimism that went before, things will be fine. But just to be cognizant and and everyone, particularly kind of young people, just to be kind to yourselves and to be accepting of these types of fluctuations. And I think I'll leave it there. Thank you very much.
Thank you very much, Eamon. That was yeah, another really important perspective. Some really interesting concepts around resilience, being in this for the long haul, what that means for our profession. Just really important to think about these things around self-care and mental health, being kind to ourselves as well. And as well, some very interesting perspectives from a frontline perspective, and what we can learn from different emergency contexts and organizations that work predominantly in those contexts. So thank you very much. So we're going to move on to a Q&A now, but just before we do that, we're going to do another quick Mentimeter survey, just to kind of get everyone involved. So again, if you could go to www.menti.com, the question that we want you to think about is how has COVID affected your work, studies, or research at the minute? So essentially, what has been the impact of the last 6 months on you as an early career professional or as a student? So if you go to menti.com, the code is 4354927, and that question should pop up for you. So how has COVID-19 impacted your studies, research, work over the past 6 months? 6 months, 9 months? Lack of interest in work, no ward-based teaching, disrupted learning, slowed work, major shift towards social media for networking, remote study, some new opportunities. I think that's one of the first positive ones. Low motivation, working from home, less supervision, cancelled exams, increased workload, inadequate PPE, so frontline workers with challenges there, fatigue, lost opportunities, stress. So a pretty bleak picture. Busy, depression, no home visits to people with dementia, disregard for other priority areas. Thank you very much for filling that out. I think that does kind of highlight just, I guess, the real depth of some of the challenges that we as a group are going to feel, are going to feel throughout this this pandemic as well. If we open it up to questions from the floor to panelists, and if any feel particularly that they want to just then we'll try to make this as informal as possible. We have one broad question that's come in through the chat already. What piece of advice would you have for students wanting to pursue a career in global public health sphere? There's a couple questions that are like that, and I wonder whether, particularly for people that work maybe in a more medical or public health field, how do you get involved in global health research? There's also a function just on the right-hand side to raise your hand if you do have a question as well, and if you want to read read your question out as well, you can do that too. So I think Kieran is raising his hand. Kieran, do you want to? So we have one question there on how you get into global health. And so we'll maybe collate a couple of questions here. Do you have a question as well?
Yeah, so I had actually put my hand up to ask a question, but I'm happy enough to contribute to this. I know I'm not one of the panelists. So hello everyone, I'm Kieran and I'm a medical student at Queen's and part of the Irish Global Health Network as well, and the committee that organised today. I suppose for me, I kind of stumbled into it accidentally. A friend of mine had just told me about a master's that was really good. You got to travel lots and all the course wasn't too bad. That wasn't really the concern at the time. And then I actually, I read a book, which I'm sure a lot of people know, Mountains Upon Mountains by Tracy Kidder, which talks about the work of Paul Farmer and Partners in Health. And that kind of changed my sort of direction of focus on where I saw myself sort of going with a career in medicine, and then taking that further. And then I did my master's in global health, and things have sort of progressed from there. But I suppose advice for people that are in sort of broadly clinical based subjects, and Rosie might be able to come in on this as well, and Eamon, I'm sure, as well. As I get involved with the Student Society, the Irish Global Health Network has been really a turning point for me, meeting people across the island who have similar interests. I mean, that's all sort of culminated in the fact that I'm here today at this conference, but also things like Students for Global Health as well. Fantastic organisations, and I noticed a few names on the chat who are involved in Students for Global Health in the Belfast cohort. Other things, like if you're interested in a specific specialty, the Royal Colleges are great. So Pediatrics and Child Health have their own international health group, as do sort of the GP Society. There's all these really sort of niche areas that you can get involved in. And that's sort of the beauty of global health as well, is there's just so many niche areas that you can find your own little specialty interest in and sort of pursue. And then if anyone else wants to answer that question, I'll leave my question for afterwards.
No, that's really interesting, Kieran, and some really useful organisations and resources that you pointed people towards it. I wonder, Eamon, do you have any thoughts on this, particularly having worked with MSF as well, and combining a career in Ireland with some of that international work? Do you have any perspectives on that?
Yeah, I suppose that there's usually opportunities, or I was lucky enough, I suppose, to have opportunity during university to go away for a summer to Ghana to do a clinical placement, and I think that gave me a really good taste early on of kind of the opportunities that were out there and the type of different ways kind of healthcare was being provided. I think the other thing, the diploma in tropical medicine, it kind of offered out of Liverpool and London and a few other places. More interestingly, there's one in Tanzania or Peru. I think it's a superb course, gives you excellent insight into everyone that teaches on the course has essentially pursued careers in global health, and it's really geared towards a doctor who might not have had that teaching in their undergraduate degree, which you unfortunately don't get kind of in Europe. It's really geared towards directing them and enabling them to be useful in that kind of environment. So they're the two things that really helped me.
Thank you. Thank you. I think that's really, again, some really interesting, tangible, useful suggestions there. I just wonder if people are comfortable turning on their cameras as well for the Q&A. You'd be more than welcome as well, so we can see each other. Again, if there's any other questions coming in, please either put your hand up and you can say them, or in the chat box. I had a question that comes, I guess, really directly from Danielle's presentation, but I think anyone, Kim and Shakira, would be interested as well to hear your perspective on it. But Danielle, you talk about breaking the paradigm, and you put up a slide that really emphasized that paradigms are typically broken either by young people or people who are new to an industry, and that sometimes an old paradigm just doesn't fit anymore and it needs to be changed. I guess, like, what is your perspective, and how do you do that? You know, I think for a lot of young people, we work in organizations that aren't the most responsive, that we are pretty low down the ladder, so to speak, and sometimes it's difficult to kind of affect that sort of change. So I'd love to hear some of your perspectives on that. Sure,
happy to do so, and thanks for the great question. I think this also ties into, I see a question someone had come up about building a network. So I'm going to kind of answer both because I think they blend together a bit. So I've found specifically, I'll talk about my experiences. So I'm a microbiologist, and then I studied global health, where I focused on health systems. And then I go into antimicrobial resistance and NCDs and health systems. And I found often the people I'm working with were kind of confused about
We've lost Danielle's feed again. Fortunately, hopefully we'll get her back in a second. Does Shakira or Kim, do you have any thoughts on that question while we try and get Danielle back?
Sure, I'm happy to give a stab at it, but I mean, it was from Danielle's presentation, but just thinking a little bit about it and breaking the paradigm. If I were to think about it, I think civil society has a very big role to play in all of this, or activism has a very big role to play in all of this. So whatever profession we're in, or whatever field that we're in, we've got to have an element of critical thinking. And also social justice, because what we're seeing in these times is a deepening crisis, a socio-economic crisis. We're on the brink of a recession. And we're just simply going to have to do things differently. It's a very tough road ahead. It's not straightforward, but in every single sense, we're going to have to be the activists, the global health activists that our society needs at this point. I think that's where we need to break the paradigm, or redesign the paradigm rather. I also think that we can also use the opportunity of COVID-19 to learn lessons. What are we doing well? What are we not doing well? Like Danielle said, looking a little bit at the failure. But also we've been able to, very interestingly, in low and middle income settings with relatively little resources, being able to reach a large population for testing, a large population, and getting the workforce prepared for COVID-19. And there's so much that we could learn from that going forward. And it just shows that sometimes, I don't know why our health systems were taking so long to get into gear, and how do we play a role in really getting us there?
Thank you very much, Kira. I think Danielle's back on the call again, if you want to.
Oh yeah, sorry about that. We have a couple of nephews downstairs in school right now, so I think it's texting the internet. Speaking of online working environments, thank you so much, Shakira, for jumping in. And I just caught the end of that, and I think you bring some very important points. And I very much think that, like Shakira said, it's going to be tough, because we are trying to push a paradigm shift in the sense that we're trying to change the way of working. And the people that we're trying to essentially get to hire us and work with and move up with are used to this kind of siloed way of doing things, and very much focusing on, this is my field, this is my area, don't come over in my lane. But in reality, we actually do need to start blending our sectors within global health together, and start sharing experiences across, NCDs and AMR, sharing experiences across emerging tropical illnesses and mental health, because the way that we engage with these challenges and the way that we create solutions for them can be translated. And making sure that you speak up and you speak your ideas. Don't think about hierarchy. I've always said that to everybody I've ever worked with, like, forget about hierarchy. That's silly. It's not important. You have to be confident in yourself. You're intelligent. It doesn't matter how many years experience you have. You have interesting ideas, and you need to share them, because that can help us actually shape the future that we're going to inherit. So yeah, I'll stop there.
It's really interesting. I think, there is this sort of intersection between professional careers and activism that has come up quite a few times. I know, Kim, that you've been involved in people's climate marches and things like that. Do you have any sort of thoughts to add to what Shakira and Danielle have been saying?
Yeah, I would say that I very much agree with what Shakira and Danielle already have been saying. I think that research can very much be used, and data can very much be used to inform activism and to inform change. And I think that in this area specifically, a paradigm shift is actually quite possible to be made, because a lot of people are more open to conversations that they were previously not open with. And because COVID-19 is so blatantly exposing all the problems that the world currently has as well. And then specifically thinking about access to medicine and vaccine developments, that are problems that, thanks to COVID-19 in a way, are also re-arising and being discussed again in the public space, as well as climate change in a certain way. So at the same time, I do think that this moment really provides a way of opening a lot of people's minds to be open to having those discussions. And that young people specifically, because we are as active and we have a lot of ideas and opinions that may be different from the mainstream, that we have a really important role in that ourselves as well. Yeah.
Thank you. We maybe have time for one more quick question. It's unbelievable how it's time is gone already, but maybe one more quick question. If anyone, any of the participants that we haven't heard from wants to put a question either in the chat box or to raise their hand.
I think someone was asking about getting involved during this time of lockdowns when you're not really able to have opportunities that are not online. Maybe that question could be answered.
Fantastic, 100%. You've volunteered yourself to answer it.
Yeah,
100%. It's a really important issue, and definitely if you have any thoughts on that, that would be great.
Yeah. So I think there are actually a lot of opportunities and a lot of things that you can do to get involved in global health or in public health or in anything online, especially in regard to research. Like a lot of research happens online anyway. So if you want to be more involved with that, I have experienced generally that it sometimes can be as simple as just emailing the researcher you have a common interest with and asking them whether they would be willing to collaborate with you on a project or whether they have a project laying around that you can help with. So that is already a very easy things, but also things as the IFMSA and UIM that are both student organizations that do a lot of their work and student activism online. So that are ways that you can get involved with public health and with global health right now very easily, even although we are confined by this online environment. And if you are more someone that wants to build their capacity and learn more, there are a lot of online courses, of course, available by edX and Coursera that you can follow to build more your knowledge on, okay, what is the difference between public health and global health and international health, and what actually is planetary health and One Health. So I think that there are actually a lot of opportunities available at this moment to enter that space. And that you, I think Daniela said this as well about hierarchies, that you really shouldn't worry too much about those and just approach the people that you're interested in working with, approach the people that you are very interested in and see whether there can be connections formed. And maybe sometimes you get a no, but very often you get a yes, and then any no is worth it. So that is, yeah, that's my perspective.
Thank you very much, Kim. I think we've got, is it Utku is looking to ask a question. Apologies if I haven't pronounced that correctly.
Yeah, no worries. I think Kim answered a part of my question. So she mentioned about the IFMSA, which I was working for 4 years right now, and this is the reason why I'm here. And I was actually going to ask a question about having a lot of opportunities as a student right now, and I'm looking forward to be a physician, but knowing all of this stuff that we can do as students, it's kind of confusing for me, which makes me hard to decide what should I be following. So I wanted to ask this question, especially to Eamon, who is working as a physician and did some work on global health. So what is the threshold that you said, yes, I want to continue as a physician, or I want to do something about global health then?
Did you say that this question was specifically for me?
No, for Eamon.
Okay, great. I was already very confused about hearing.
Oh, sorry.
I think, sorry, yeah, I think my most valuable bit of advice on that is, I suppose, not to, it's kind of unsatisfactory for me to say it at the minute, but as a medical student, I did my elective, but it was actually a kind of postgraduate. What I did was I didn't rush things, essentially. I decided what I was interested in, and kind of to work with MSF and to do the tropical medicine diploma. I just done a bit of training, but I took 2 years out of my training because I knew it was something I wanted to do. I knew it was an experience I wanted to have, and I knew kind of like that rather it's very easy to get stuck, particularly as a medic, in a sort of a rat race, and you get very blinkered when you're a med student doing training and a doctor doing training. You're looking around you and people are all kind of focused on one thing. But yeah, my key point of advice is just, if you're interested in global health, have that, like, kind of there's plenty of time. Just have that as a focus for a while. And if you need to take some time out, if something, I wouldn't let that be an obstacle to what you want to ultimately achieve.
Thank you very much, Ian, as well. I know that there's a couple more hands that are raised, but I'm conscious that that we've ran a little bit over time, and I think it would be really good to continue some of these conversations in the breakout rooms. So you'll have an option all the speakers on as well. I'd just like to thank the speakers as a group for joining us today and sharing some really interesting insights into this time and this context. And just before we close up as a full, to say a couple words, a few different projects that members of the team that have been involved in organising this conference have been involved in that might be of interest to the participants of this session. So one of the things that Queen's University in collaboration with University in Galway and a couple other collaborators have been working on is doing a survey on global health education for medical students within the UK and Ireland. So trying to students currently get and what they would like to get. So if anyone has any networks or interest in that project, please get in touch with us. We're going to be pushing that survey out and we're trying to get as good a response as possible. And the second piece of work that the panelists were discussing in our prep for this and that Shakira raised was trying to use this network, and I think we have 80 odd people on this call, and trying to, in a more formal way, collect some of the collect information and data on some of the challenges that young people within this sector are facing at the minute. And I think that that would be a really interesting and useful project. We are going to have a commentary report that has been written up about this session that will be circulated to everyone after the conference is finished. But I think it would be interesting to do a bit of work on that as well. So just keep an eye on your emails post-conference, and hopefully we'll be able to reconnect around that project as well.
That's great, thanks, Chris. So it leaves it up to me to officially end this session for today. I've just realized looking at the screen, it looks like I'm sunburnt, but I haven't been anywhere near the sun, so I'm not sure what it is. So we're ending the Young Professional session on the first day of this conference. It's been an absolutely fantastic day. Thank you for everyone who's joined us. It's not quite over yet. We still have our Speakers Corner session. So the speakers who have been who have so willingly presented this evening are going to be available in breakout rooms for 10 minutes. So if you would like to speak to any of the individuals on a more one-to-one basis, or ask them for advice, or just network like you normally would, please feel free to join one of those rooms. You can do that either by clicking the link in the chat or visiting the website globalhealth.ie/QUB. /Speakers Corner, and that will give you the direct links to those breakout rooms. Other than that, thank you very much for joining, and we hope to see you tomorrow for day 2 and the final day of our conference, Healthy People on a Healthy Planet.